Welcome to North Star Physical Therapy Podcast. I'm Dr. Shirlea North, and with over a decade of clinical expertise in the areas of pelvic floor conditions, lymphatic conditions, and chronic neurological diseases, I have a wealth of medical knowledge that I want to share with you all. In this podcast, I will answer the most common questions I receive from clients, family members, and fellow clinicians. Our purpose is not only to answer questions, but to educate you so you can make the best decision for your optimal health. This podcast is perfect to listen on your way home from work, while you're on your daily walk, or just taking 15 to 20 minutes for yourself. Again, welcome to North Star Physical Therapy Podcast, and get ready for us to guide you to optimal health.
Hello, everyone, and thank you so much for joining me for those that are returning back to the podcast, as well as for those who are newer to the podcast. So today's topic, I'm purposely releasing in the month of February because we are around the corner from Valentine's Day, and we all know that's one of those really commercial now, but they're romantic evenings, or it can be for either self or with partner. And so this is a very important topic that often is still considered taboo of talking about sex and penetration. But we're going to look at it at the lens a little bit more medical and what we do as pelvic floor PTs to assess and to treat. But what is it? What does it mean? What is dyspareunia? What what is all of that? So for today, our podcast is all about dyspareunia. Dyspareunia means pain with penetration. And so we're going to talk a little bit more in general, even though I treat very holistically and as well as with any pelvis. So within male, woman, or in the trans community, it doesn't matter to me. We all need to make sure we can have pleasurable intercourse, pleasurable penetration. I find that's very important for us physically and emotionally. So the terms I'll be using for this podcast is going to be more those general terms that most people refer to. So thinking about the anatomy of vagina, anus, sex, intercourse, those kind of things, okay? So dyspareunia means pain with penetration. And so dyspareunia is also, can be classified as superficial or the surface, introidal for those with vulva. So that's right at the opening. And so it can be, again, those with a vulva, so those external tissues, or with the anus, and it's still that external tissue. So it's very superficial discomfort with that immediate penetration. There's also deep dyspareunia, and so that's upon either when penetration has kind of crossed the entry and you're now into the deeper structure of either the anus and rectum, or for those with a vagina. So whenever someone comes with me with a symptom of pain with sex, first of all, we need to define what sex is for themselves or with a partner or partners. What does that mean? So it's a very open dialogue. We need to have that kind of transparency as providers. And as providers, we need to help support that environment as well, so clients feel comfortable relaying that information. But we're not trying to be nosy and asking 1,000 different questions about your sex life per se, but if that's your main symptom, we kind of need to know the background knowledge of when you say this term, we're on the same page, as well as understanding, any kind of cultural things or our personal preferences. We as providers need to put our personal preferences aside first and foremost, so that way there is a neutral space for your preferences. So whether or not that's with certain partners or toys or foreplay actions or very missionary-esque, it's what does that mean to you? And that's super helpful for us as providers, so that way we're not trying to do certain interventions that are one, you're uncomfortable with, and number two, that you can actually replicate and communicate that to, if there is another partner involved, communicate these things with, and we give you those tools to do that, and for you to feel empowered, and that pain with sex is not normal. It is not normal. We should never suck it up for our partner, suck it up for potential childbearing. We should never deal with pelvic pain. We should never deal with pelvic pain with any kind of penetration. And that could be with intercourse. That also could be for those that have a menstrual cycle, could be with whatever menstrual device you use, like a tampon, a cup, or a disc. So you can have dyspareunia because that's still penetration. You can still have dyspareunia whenever you have to have pelvic exams or rectal exams, or vaginal exams to get to the pap smear test. Like, this all counts as penetration for us. It's not just within the intimacy space, but we do want to talk about that in prep for Valentine's Day here. So I thought this was a very appropriate month to release this podcast. But I just want to get the overall basics down of dyspareunia, pain with penetration at vaginal tissue, rectal tissue. It can be for intimacy, sex, intercourse, and whatever that may mean for you, whether that's with a toy, with a finger, with a tongue, with a penis, with whatever, right? What does that mean to you in what area, or both? And then also it could be for just medical exams, right? For rectal exams, for prostate exam, for vaginal insertion, for menstrual device, or vaginal insertion for a pap smear, or for an IUD placement. So we need to make sure we can not just tolerate, but it's not painful. So as a pelvic floor PT, so now that we have the ground rule what dyspareunia is and why it is so important for pleasurable intercourse, sex, penetration, with self and partner, as well as being able to tolerate medical exams as well for our overall body and organs and health and tissue health there. So we need both, okay? As a pelvic floor PT, there are a wide variety of contributing factors. I'm going to list off a few. And I want to do this not to overwhelm, but to show how much within our scope of practice of pelvic floor PTs that this is totally within our realm, but we can also collaborate with other providers if we need medical intervention, some of these things, or behavioral mental health things. But it is way more complex, but then we want to say that to not worry you, but we want to say that this is why it isn't just a one and done visit. Just being able to talk to somebody, there are several times when someone comes in with a symptom of pain with penetration or dyspareunia, that we may spend the whole session just getting definitions down, or just communicating what does that mean, what's a safe position, what is that definition to them, and what do they feel comfortable with, and what our goals are. And because this can open up a whole world of possibilities of contributing factors, as well as self-realization of what's going on with them and their personal preferences, and how it may not match up with partner, or how it may, it's that conversation. It could potentially take that. And that's where, being within private practice, I can take that time with somebody to, number one, be able to share, to be heard, to be validated, and so that we're on the same page moving forward. Also, I could take potentially a whole session just assessing the pelvis and just seeing what's going on there. We do some treatment within that, but sometimes we don't want to flag or tag or trigger any prior abuse or sexual issues there. And so I'm very careful with that, and always ask continued consent. So I divert from my original thing there, just because it's a very intimate place, it's a very intimate moment, and we've got to be really taking things, we're not speeding things up just to get it done. And so being in private practice, I can do that and not be dictated by what insurance tells me what I can and cannot do. That might be for a different podcast, but moving back to what pelvic floor PTs really look at. Well, yes, we do look at the orthopedic stuff going on. So at the pelvis is that keystone in the body. We have the spine right above it. We have the hips on either side, and we have structures in the front, the side, underneath, everywhere, right? We're a 3D structure. So we do look at the joints, we do look at the ligaments, we do look at the tendons, we do look at the muscles that attach at the pelvis that are outside of the pelvis. So that's like the external to pelvis exam that we go over and screen to see if there's any hip joint issues, if there's any low back joint issues, if there's anything going up in your mid spine with your thoracic spine, and how we're breathing and how that pressure is coming down or not. So we're looking at all of those muscles and joints, tendons, like all of that, right? So kind of our typical, when you think of PT does kind of thing there. We also look at the muscles and soft tissue, the tissue health externally to the pelvis. So for those that are going through hormonal changes, whether that's postmenopausal or through transition hormonally, that changes the tissue health down there as well. For those that have gone through any kind of medical treatments or on any kind of hormonal treatments, yes, it changes the tissues down there. We want to make sure there's good lubrication. We want to make sure that you are checking those tissues there as well. And so there are external muscles there as well. And so we want to check those out. So those are like part of the pelvis itself, as well as internally. So yes, you say, well, how can you check internally if with internal penetration that hurts? Very, very careful, right? So I do a screen of sensation and hypersensitivity of the external tissues, and I make a judgment call if we need to work on those things first to help reduce that sensitization and to help that area so that we can tolerate even just a small insertion. We do that. Sometimes there are folks that we do okay with that external tissue, and then it's not really until the deeper penetration that they have symptoms. So going immediately internally is bad, but I am very, very careful. And most of the times my finger, is not the same size or functional size as maybe the toy or the penis or the finger that, a partner has. But if someone has difficulty with tampon insertion, or if they are on vaginal estrogen suppository, the applicator insertion, I'm just very, very careful, and I stop when the tissue tells me to stop. I stop when the client tells me to stop. I stop when I'm looking at any kind of nonverbal cues. So that's why we take our time. So we're looking at all the soft tissue, the muscles, the joints, the ligaments, the tendons. The other soft tissue I'm looking at is if there's any scars, if there's any adhesions, if there's been any prior labor and perineal tears, if there's been any C-section, if there's been any gender reassignment surgeries. There's a lot of scar tissue there. And so we want to make sure that scar tissue is moving and it's not restricting any of that fascia or soft tissue from moving and stretching and expanding that needs to occur during penetration. So we're looking at that soft tissue as well. We are also looking at just taking a step back and what positions pleasure you, what positions do you find you that discomfort gets alleviated, if at all, or if it exacerbates. So sometimes I do have a little bit of a physics lesson when your pelvis is in this position, or when your penis is at this angle, because it isn't always female or receiving partner with pain with penetration. It could also be the penetrator too. So we're looking at the angle of entry and to see if that angle is also associated with some of those orthopedic factors, and work on that to alleviate that discomfort, or to maybe also suggest in the meantime that, hey, let's maybe see with some real-time feedback if I adjust my pelvis a little bit one way, maybe like tilt it back, for example, so your back is flat if you're on your back, and then we adjust the angle of entry. Does that alleviate anything? Or do I need to angle forward? Do I need to go a little bit to the side? Because we're not all perfectly straight. We're not all, and with gravity, and we're not cement down there. So there's soft tissues and it moves, and depending what position you're on, so either on your back, in a sitting position, on all fours, things move. So we need to move with it. I think sometimes what Hollywood and the porn industry puts out there is so fake and it's not real. And photoshopped and sped forward, and it's just, that's not what it's all about, and that's not real. That's not in real time, and there are sometimes enhancements and things like that. So I think sometimes when we look at that as an example and then we go to real life, it is a very different situation. So we want to look at just position and angles, right? A little bit of geometry, a little bit of physics. And so that's where I have models, but then I also utilize manual feedback, so that way the person can feel the difference, and then be able to give them the tools to communicate that to partner, or how can we mimic this at home? Do we need to have some pillow props? Do we need to adjust the position of certain things for that pleasurable penetration? Or if it's more like, I'm okay with that, it's at the medical office and that's the issue, then how can we talk to our other providers and be like, hey, I need to be in this position. Can we do this assessment, or can we do this test within this position? Or how can we alter? Like, giving the tools of communication is very, very helpful. Speaking of, we also want to make sure we're taking a peek at our nervous system. How we act within a clinical situation versus how you're at home and having intimacy with your partner, and there's that psychological piece to it, is different. And we want to also respect that. So oftentimes we're doing any kind of nervous system down training, as well, because our body keeps the score. So if we're really stressed, if we're really anxious, if we're in pain, we tend to the tissues tend to increase the tension, or you quote unquote clinch, and that doesn't serve well when we're trying to have that pleasurable sex. So what are some things that we can do to help with that relaxation, with breathing, with positioning, with stimulation, with exploring other pleasurable sites as part of foreplay? Just listing off some examples. So we do look at nervous system regulation. If I find that we maybe need to, it's beyond my scope, and we maybe need to have a mental health or behavioral health specialist be involved for that, or a sex therapist, I absolutely refer to some trusted clinicians that we can collaborate with. So that way, if there's something that's mentioned within that session, can we incorporate that into the physical environment, right? So we do look at nervous system regulation there. We also want to screen out any kind of hormonal changes, like I mentioned before, with any kind of tissue health changes with that. We also want to screen out any kind of vein involvement. So in our pelvis, we need blood supply. That blood supply brings nutrition, and it helps bring stimulate lubrication as well. And if we have any kind of compression within our veins, within our pelvic veins, that could also give rise to like pain. So think about if you have like your foot fall asleep, right? There's pins and needles, and it's like, oh my, and like it hurts, right? Well, we're not getting that blood supply. We're probably clamping the blood supply to our foot, just with maybe our position. And then when you like stand up and when you move your foot, you're like, oh no, it's asleep. And it takes a little bit. Well, imagine if that's happening outside the pelvis. So it could also be something like that as well. And so I do have some tried and trusted pelvic vein specialists that I refer to most of the times to just like kind of rule it out. And that can be a very simple ultrasound. And if we need to move forward within that realm, we do conservatively. So check out my pelvic congestion podcast for that, and any kind of conservative treatments there. But I'm mentioning that just because of the complexity of the pelvis. There are muscles, there are joints, there's soft tissue, there could be some scars, there could be some vein involvement, there's nervous system involvement with the nerves that supply there, there's hormonal changes, position and potentially lubrication needs as well. So many things that we look at for one symptom. And that's something that at North Star Physical Therapy we can absolutely investigate. We kind of put our little detective hat on and we look at all these contributing factors. We kind of screen things out and assess things comprehensively. And that way, okay, out of these things, what's your priority? What do you think that we can impact first? And we go there. And then we go to the next thing. Sometimes I've had clients that it's a whole laundry list, but if we worked on one item, it helped some of the other ones too, because it's so integrated with each other. Sometimes there are more complex things. Sometimes I have somebody with a scar who's upregulating their nervous system, who's had hormonal changes. It's like, okay, what can we impact right now? And what are we going to change right now? And change that, great. Let's do the next thing. But yeah, sometimes it just is maybe a positional change or just a little bit of a shift that can make the world of difference. So my goal whenever someone comes in with dyspareunia is, number one, can we tolerate any kind of medical exams and positions? So that way that can be assessed in tissue health and all the things there. But also, can we have pleasurable intercourse, whatever that may mean to you? And have it be pain-free. It's huge. It's like it's such an amazing moment when someone can step into my office and be like, I had sex pain-free. That's wonderful. That is wonderful, and that's really a part of quality of life as well. So to that end, now we know a little bit about dyspareunia, what it is, why it's so important for us to treat it. As pelvic health PTs, we are very comprehensive in doing that, and we work and collaborate with other medical team if we need to. But it is a very still taboo topic that we want to just open up that conversation and know that there are providers that can help you with that, or that can help screen for that as well. And it's way more common than you think. It's just people just don't talk about it. And they know I'm talking to their healthcare providers, but we are one that, please, we are an open door here for that. But it is not normal to have those symptoms, just no matter who you are or where you are in your stage of life. But there's absolutely help that can be provided for you. And so we're here for you for North Star Physical Therapy. So feel free. I do treat virtually as well. So if you're not in the DC metro area, not easily accessible to my office here in Northern Virginia, no worries. We can absolutely go through a lot of these things virtually as well. That's why models are amazing. We made it through COVID doing it. So we want that accessibility to care and the care that you deserve. So I look forward to hearing any kind of comments and feedback, any kind of questions or any kind of topic suggestions coming up. But have a very happy Valentine's Day, whether that is a self or with partner. And I look forward to seeing you all next time.
Thank you all so much for listening to North Star Physical Therapy Podcast. Continue to follow me on Facebook or Instagram at Dr. Shirlea North. Check out my website at www.northstardpt.com, or I encourage you to email me any other questions about these topics, and it can be featured at a future podcast at snorth@northstardpt.com. Again, thank you all so much. And thank you for letting North Star Physical Therapy be your guiding light to your optimal health.